So the idea is to talk about ear and sinus barotrauma. It is taken from Make Manual Professional Edition, and this chapter in Merck was written by this guy. So credit from them. Now, the we are talking about barotrauma. So in diving, so we're talking about changing in pressure from the outside world because of the change in height under the water. Remember that every 10 meters that the diver dives, raise the atmosphere the pressure by 1 atmosphere for every 10 meters. Now, barotrauma, as we said, is by the pressure outside. It can affect, we will talk about affecting the ear, middle ear, inner ear, and the sinuses. And as a result of this, it can also affect the nerves, the trigeminal there, the maxillary branch, from damaging the maxillary sinus, or it can also damage the facial nerve or the optic nerve. We will see this. So in the ear, we can have symptoms of ear pain, which is the most common but the least severe. Hearing loss, tinnitus, vestibular symptoms. If it damage the inner ear, it will be very more, let's say, problematic than only affecting the pressure without any perforation of something. It can cause tympanic membrane perforation, it can cause bleeding, it can cause inner ear pathologies, especially tearing of the oval window, round window, and the membranes between the lymph fluids, endolymph and perilymph. In the sinuses, it can damage the sinuses, cause pressure-related pain in most cases, but in very severe and rare cases, it can cause rupture. It can also cause congestion. Especially the problem is when all the system is congested, like in upper respiratory tract infection, allergics, where the patient is not stabilized and the allergic reactions are quite massive. Okay, diagnosis, it depends. If it's only barotrauma, which is superficial, let's say only ear pain without hearing loss, without tinnitus, without vertigo, so it or just pain in the sinuses without any bleeding or signs of a rupture or something. So we just clinical evaluation. But if the patient uh, tell us about hearing loss, tinnitus, vertigo. So we need to think about vestibular damage. We need to think about inner ear barotrauma. So we can do audiometry and vestibular testing also. If there is tympanic membrane perforation, we can look for conductive hearing loss and tympanometry type B, for example, or C, not normal tympanometry. Treatment, it depends. Decongest can help relieve occlusion if there is. Decongestants even can use to prevent those damages. Sometimes steroids and in severe cases surgery, like in inner ear barotrauma when the oval or round window or the membranes are torn. Sometimes surgery, prompt surgery, uh, can help rehabilitate the hearing loss, and it's quite important to identify. Okay, so the diving effect. You can see what the effect can cause: pressure, pain, tympanic membrane perforation, disorientation. If cold water enters the ear, especially if there is tympanic membrane perforation, it can cause disorientation. If there is inner ear barotrauma, so inner ear barotrauma symptoms, damage to the inner ear can cause tinnitus, hearing loss, dizziness, vertigo, and you can see the sinus barotrauma. Mainly it affects the frontal sinus, but it can also affect the other sinuses. Uh, this vision loss is because if there is pressure from the sinuses on the optic nerve, it can cause vision impairments. Diagnosis is usually clinical. If you think about very severe things like a rupture of a sinus, you can use a CT to identify it. Treatment usually it's symptomatic with decongestants and non-steroidal for pain. Sometimes steroids. You can see here that the steroids sometimes used, but not universal acceptance. For middle ear barotrauma, you can use steroids, tapering of steroids. For signs of infection, you can use antibiotics. For bleeding or evidence of a fusion, and if there is a need for urgent surgery, like a ruptured of round or oval window in the inner ear, so it may be used. Myringotomy if there is a fluid, and sinus decompression if there are very severe effusion in the sinuses or something. Okay? Prevention mainly decongestants you can see here, and not diving when you have good congestions like from upper respiratory or allergic rhinitis. So this is it. This was about wait, I try Gemini. Yes. Okay. This is it. This was about ear and sinus barotrauma. If we are looking back, thank you very much. If there are any mistakes or things you want to correct me, please correct me. And that's it.